Good afternoon. I'm Dr. Dale Bratzler. I'm the Chief Quality Officer here at OU Health, and I'm the University of Oklahoma's Chief COVID Officer. I'm going to do something a little bit different today. I'm going to present where we're at in the pandemic and talk a little bit about the 2 years that we've been in this pandemic. And then I'm going to highlight some more recent news. Some of it's been kind of interesting that I think we should all be thinking about. So the first thing, let's just start and talk about where we're at today. As of this morning, Oklahoma is at 21 cases per 100,000 population per day. That's dramatically down. In mid-January, we were above 300 cases per 100,000 per day. The lowest we ever got during the pandemic was 3 cases per 100,000 per day, and that was in June of last year. So we haven't gotten as low as we've gotten before, but the cases have obviously come down substantially. In fact, we're down about 93% from the peak that we saw in the pandemic. The hotspots in the country include Maine, the Appalachians, South Texas, Alaska, Montana, and Idaho right now. So those are where the most cases per day are. So let's think about the pandemic in perspective. So as of today, there were another 920 cases that were reported in the state. We're over 1 million cases, as everybody knows, 14,730 deaths. Just within the past week, we had just under 6,000 new cases and 242 more deaths. I think the one thing that many of us have been noticing is that provisional death count has really gone up a lot. And I think it's because we had so many people who ended up hospitalized. About a quarter of them were in the ICU, and sadly, deaths do lag when patients are that sick, and we see deaths then happen over a period of time. Let's think about it since the start of the pandemic. We're just under 2 years into the pandemic now. As of today, if we had been able to predict on March 6th in 2020, we would have predicted 1,409 cases per day in Oklahoma and just over 20 Oklahomans dying every single day during the pandemic. So when you start to think about it in those terms, that 20 Oklahomans have died on average every single day during the pandemic, the numbers are really staggering that we've seen. Again, case counts are down. At the peak of the pandemic in mid-January, we had one day where we were at almost 15,000 cases. With the Omicron surge, again, today we were down to 920 cases. And if you look at the 3-day and the 7-day averages of new cases per day, they're both continuing to go down, though particularly the one I watch most closely is the 7-day average. It is coming down, though it's coming down very, very slowly. So we plateaued with number of new cases per day. Another slide that I kept in here was to look at deaths in Oklahoma from COVID-19. And while we have a lot of counties in our state that don't have big populations, when you look at the population incidence of death from COVID-19, the highest numbers have been in many rural counties of Oklahoma. And when you look at this graphic, you can see the number of deaths in rural Oklahoma in many rural counties as compared to our large counties like Oklahoma, Tulsa, or Cleveland County. So again, this pandemic has had a huge toll. It's had a huge toll in rural Oklahoma on families from the number of deaths. I'm happy to report that hospitalizations continue to come down. We've had a 2/3 reduction in the number of people in the hospital, and as of today, there were 529 people in the hospital, with 128 of those patients in the intensive care unit. So again, that was good news to see that hospitalizations continue to drop very rapidly. Lastly, before I go into some of the new news for this past week, I just want to highlight the community transmission maps. We now have 2 different maps, one that CDC updates every day, and then last Friday, they published a new map that is the community transmission map that has not been updated. I'm making an assumption that they may update it once a week, and if that's the case, maybe it'll be updated on Friday. But if you look at the community transmission map, the one thing, if you've been following this map over time, there's color on it now. We do have counties that have dropped into the moderate transmission category, and then Tulsa County, a large county with a lot of population, has fallen into the substantial spread of the disease. So we're finally starting to see the case counts come down at the county level based purely on case counts. Of course, the new COVID map, community levels, is based on 3 different criteria: the number of new cases per day over the past week, the number of new hospitalizations per day over the past week, and then the percentage of hospital beds that are filled with COVID patients. The one thing I'll point out here is the larger counties with the bigger hospitals and the referral hospitals may actually be at some disadvantage with this methodology, because even if case counts come down substantially in Oklahoma County or Tulsa County, because you have the larger referral hospitals that get many of the patients who are transferred from around the state, our larger counties may continue to see higher numbers of COVID patients admitted per week just because they're transferred from other parts of the state. So, in fact, this past week we saw that Cleveland County now was in the moderate category for community transmission, but Oklahoma County remained in the high transmission zone of the state. So just one thing to watch over time to see how that plays out. So a couple of interesting papers this week that I thought I'd highlight. The first one was published by CDC. Just in fact, the news came out, medical news came out today. The data goes through the end of 2021. And they looked at all of the private labs around the country that do blood antibody tests for COVID-19. And they specifically looked only at lab work that was testing for the anti-nucleocapsid protein that's in the virus. When you get the shot, the vaccine, your body does not make anti-nucleocapsid antibody. So in other words, the only way to have anti-nucleocapsid antibody in your blood is to have previously had COVID-19. So this study looked at how many people had COVID-19, and the results were fairly striking. 43% of Americans on this testing had antibodies against COVID-19. In Oklahoma, it was 45.7% of the population. That was 1.8 million Oklahomans have had COVID-19. And as we know, having the infection does give you some natural immunity. And so that may account for the fairly rapid decline in cases that we've saw since the Omicron surge, which infected so many people in our state and across the country. So I thought it was an interesting study that's really trying to get at how many people have actually had COVID, because we know there are many people in the community who get infected but don't go to a lab and get a test done. So this is just an estimate of the number of people who have already had infection. There was another article this week that caught a lot of attention, and it was on the effectiveness of the Pfizer vaccine in kids between the ages of 5 and 11. In this particular study, which was done during the Omicron surge, they found that when kids were vaccinated, they had pretty good immunity at first to getting COVID-19. But that immunity fell off rapidly over a period of almost about a month. The protection against an infection dropped substantially. And in fact, it dropped down to 12% after 1 month after receiving the first 2 doses of the vaccine. So it raised a number of questions. The first question is, what is the interval between doses of the COVID vaccine that we should be targeting? Remember, if you get the Pfizer vaccine, it's recommended you get your first dose and then you get your second dose 21 days later. Is that the right interval? There are actually questions in adults about whether that interval is correct and if a longer interval would give you better protection against infection. The second thing is the dose correct? Remember, for kids 5 to 11, they get 1/3 of the dose that an adult or somebody that's 12 or over gets. And is that too low of a dose? Maybe it's not. And again, that is being studied at this point to look at what is the optimal dosing, both interval and the optimal dose that will give kids the best immune response to this vaccine. Many have heard that Pfizer has been studying whether or not you should get 3 doses of the vaccine in kids to get an optimal immune response. And remember, that's not uncommon. There are many vaccines in kids that we do give 3 doses for to get the immune response. So again, it's still being studied. One point, I read the actual article, and one point that they did make was that being vaccinated, even in this 5 to 11 age group, did substantially reduce the risk of severe disease, death from COVID-19. So even though it didn't keep all the kids from getting COVID, it still gave them substantial protection against the complications that we're concerned about from COVID-19. So more study to be done on that particular topic. The second thing that I highlighted in the handout, I put a slide in the handout that everybody will receive that I've used before, that was a study of 8 million people who got COVID-19. About 6 million of them were unvaccinated, 2.8 million were vaccinated. And they looked at what the risk factors were in these vaccinated people that might predict that they were at risk of COVID-19. So there were 8 risk factors. I'm going to highlight them again. Being above the age of 65, being immunosuppressed, for instance, organ transplant, cancer chemotherapy, drugs that suppress your immune system, diabetes, kidney disease, neurologic disease, cardiac disease, pulmonary disease, and chronic liver disease. And on the right side of the graphic, I highlight how common those conditions are in Oklahoma. So people have been asking, are we to the endemic phase of COVID-19? Is it safe to start thinking about doing things such as going without your mask in public, in indoor settings? CDC has, in their new guidelines, said that 70% of the country doesn't have to. And my only point is that the struggling part of this conversation, there are some doctors who don't agree with the CDC on their new policy, because we know that there are people in the community who do have substantial risk factors for the complications of COVID-19. And you probably won't know who those people are when you're in the community. We know that people get infected with COVID-19 and don't have any symptoms, but potentially can spread the virus. So I think it's one of those difficult things that I'm convinced that if you're younger, if you're healthy, if you don't have chronic illness, and you're fully vaccinated, your risk of complications of COVID-19 is incredibly low. And you're not going to have the severe complications, hospitalization. But just think about the people you're around, and think about the setting that you're going to. So I don't think you should ever go into for instance, a nursing home without wearing a mask. Healthcare facilities around the country still require masks, and I think they should continue to, and probably will for quite some time to come, because of the vulnerable people that are in those settings of care. So that's what's made this whole thing about how do we back off on our mitigation strategies very, very difficult at this point. Okay, 2 last fun things. The first one is, in a previous presentation at some point, I put in this slide, I was giving a talk to Leadership OKC. It was right at the end of the Delta surge, before Omicron. And my last slide again was, what could go wrong? Well, the first was, I put Africa. And the reason I put Africa, because the whole continent's vaccination rate at that time was only 4%. Only 4% of the population of the entire continent had received the vaccine. And sure enough, from Botswana and South Africa, we saw this new variant called Omicron that spread across the world and caused the highest peak, the highest number of new cases of COVID that we'd ever seen. But the second part of my slide, and this is the thing that I found kind of scary, is I said, is there an animal vector for this virus? Now we know COVID can infect dogs, cats, big cats, and other animals, But a number of studies have shown that white-tailed deer are very susceptible to COVID-19. And a study out of Iowa that I saw, they found antibodies against COVID in almost 90% of the white-tailed deer that they tested. Well, a paper was published this week, and I put at the top, please say it's not true, but a study out of Canada that found a new variant of COVID-19 with 70 some odd mutations, and they documented what appears to be transmission from deer to a human. So it's one of the things that we've been concerned about. If we see animal reservoirs for this virus, and the virus can continue to mutate in those animal reservoirs, is there the possibility that we will see another animal to human jump of this virus that may result in another variant spreading around the world? So this is a single case that was identified in Canada. They did genotyping and basically showed that this human was infected with the type of virus that they were finding in deer. And so it looks like it may have jumped from deer to this particular human. That person lived in the area where they'd found this new variant in the deer. And then the last one I put in today was there were a couple of studies that were published this past week that said that, is the origin of COVID-19 settled? Because two papers were published that said it probably did come from that seafood market, that wet market in Wuhan, China. And I just wanted to highlight that the lead authors of the study that came out and said it really looks like it came from an animal, probably from all the animals that are brought together in these wet markets in Wuhan, China. The lead authors were from the University of Arizona, Johns Hopkins University, and the Scripps Research Institute in the United States. It wasn't a foreign study. It was a group of researchers from the United States that did this study, and again suggested that it's very likely that this is what we call a zoonotic infection. Animals got infected, the virus made the jump to humans. So we still have to worry about that, and now we have to worry about white-tailed deer also. So I'm going to stop there and try to answer any questions.
On the deer, so it wasn't that he was a hunter and he had eaten the venison, or?
Yeah, so the question is, what do we know about the person who was infected? I didn't see anything in the article that talked about whether he was a hunter or anything else. It's just he had the genetically identical virus that they had been evaluating in deer in Canada, and he lived in that region. So how he got it, I don't know. There had been conversations about, are hunters at risk? Now generally it's an outdoor activity which has less risk, but some people have suggested that the process of actually dressing the deer in the wild, if you do hunt, may put you at some risk of aerosolizing the virus. And so some people have even suggested that you wear a mask, particularly when you're dressing deer. So this is a single case. I don't want to put too much into it, but it's one of the things that we've been concerned about. Is there an animal vector that could potentially result in variants that then would jump back to humans?
Okay. So you talked about the vaccine for ages 5 to 11 already, and it only being maybe possibly only 12% effective against Omicron. Did you go into that detail?
Yeah, I did. So,
Okay.
so basically, the study that was done was during the Omicron variant, which again, highly contagious and infected a lot of kids. And so they looked at a group of kids who had gotten the 2-shot series of Pfizer vaccine, and right after they got it, in that first 14 days or so, it was 75% effective at preventing them from getting infected. But 28 to 30 days after the second shot, it was only about 12% effective at keeping them from getting the infection. So it wasn't very good at preventing symptomatic COVID-19, but it was very effective at preventing severe complications of the disease, keeping them from dying from the disease. There were some kids that were hospitalized, but they didn't have as severe disease. So they still recommended that people continue to get their kids vaccinated, protect them from the complications of the disease. Remember that kids have lower risk of some of the severe complications than adults do. And we know that kids can spread the virus to adults. So there are several reasons why we still need to get kids vaccinated, but some will have breakthrough infections.
All right, and I know you talked about the masking and the immunocompromised or high-risk people, but just is it time to think about living with COVID and treating it like it's endemic?
Yeah, so the question is it time to think about living with COVID and that it's endemic? I don't know if I can say yet that COVID is endemic, but I do think we have to learn how to live with COVID-19. So I watched part of the president's address last night. There were very few masks on in the Capitol chambers. I watched a basketball game, one of our local universities' basketball games, and very few masks in the crowd. Let's face it, people are going into public settings and not wearing masks. And so I think we have to shift some of our focus to identifying those people who are at risk of the complications of COVID-19 and helping to educate them about ways to protect themselves, including wearing high-grade quality medical-grade masks when they're in public settings. But the other thing I've been trying to highlight is that we have treatments now for COVID. So if you have symptoms of COVID, you should get a test done. And if the test is positive and you have risk factors, some of those risk factors I mentioned for severe disease, we actually have very effective treatments we can use now to keep you out of the hospital or keep you from having complications. We have 2 monoclonal antibodies now that we can use. We have 2 oral antiviral pills we can use. We can sometimes give convalescent plasma. We can give IV remdesivir. We have a variety of treatments that have been shown to reduce your chance of being hospitalized if you're at risk for the complications. And so while not every doctor routinely makes these referrals, I think it's very important that people understand that there are options available. They're becoming more available now that there aren't nearly as many cases. So the antiviral pills, as an example, are becoming more available, and people need to seek those out. If they get sick, get a test done as quickly as possible, and if it's positive, these treatments need to be started quick.
And do experts think the Omicron surge was our last big surge?
I don't know what experts think about whether Omicron was the last surge. I mean, there's still big chunks of the world where vaccination rates are quite low. And so a new variant somewhere could appear that's more contagious and spreads again. We haven't seen any taking over right now. The stealth Omicron variant, or Omicron BA.2, has been spreading in Europe, but it doesn't seem to be replacing. It's not putting more people in the hospital at this point. We found it in more than 20 states in our country, but it hasn't taken over, and overall case counts continue to come down. But look at what's happening in Hong Kong right now, a country that's had strict COVID protocols, and had very low case counts. And now they've gone from an average of 100 cases a day to this week they hit 34,000 cases a day. They have this huge, highly vulnerable population who had not been exposed to Omicron before, and it does appear to be Omicron that's spreading in Hong Kong, and case counts are just enormously going up in that country. So I think we'd be foolish to say that this is over right now. We're hoping that we have enough people with some natural immunity and vaccination that the risk is lower, but variants are the big unknown.
Okay, what do you know about how hospitals are doing across the state?
Yeah, so hospitalizations are way down. I didn't calculate today, but they're about 65% lower now than they were at the peak of this Omicron surge. We're about down, we're approaching the low levels that we saw at the end of the Delta surge. before hospitalizations started going back up with Omicron. So hospitals are in much better shape. Now remember, hospitals don't have nearly as many staff as they used to. Nursing has been the big problem in Oklahoma, and across the country. So hospitals are still quite busy. And then one of the things that we've seen is people have delayed care. During the big surges, they didn't want to be in the hospital. They didn't go to the hospital. People have delayed care, and they're showing up in emergency rooms or in the hospital or in their doctor's offices with more advanced disease. So I think we're going to be kind of digging out of this for quite some time to come.
Anything else?
Nope.